Good morning. I'm Scott Crowell. I'm the Acting Executive Director of the Suquamish Tribe, as well as the Director of the Department of Community Development.
And I'm Jamie Gooby, Suquamish Tribal Member, Human Resources Director, and Interim Co-Executive Director of the Suquamish Tribe.
Today we're doing a walkthrough so that we can administer vaccines for the COVID-19 virus on Monday. What was involved in the walkthrough today was just the logistics to make sure that we knew exactly what times folks would be showing up, how many people would be showing up, how to queue them in the lines, making sure that we have the appropriate number of staff members to make sure to get their paperwork done and make sure that we have the appropriate number of nurses to do the inoculations, and then furthermore to make sure that people can wait the appropriate amount of time to make sure that they don't have any side effects, either 15 minutes or 30 minutes, depending upon your personal health.
And today it was really important that we got our internal teams together, including the emergency operations team, Sherry May, who is a Suquamish Tribal member, who is the leader of the EOC, as well as our program manager and logistics, Chief Lasner, so that we could get all on the same page and figure out how we can make this safe and effective for everyone.
The vaccination that the Suquamish Tribe has decided to go with is the Mederna vaccination. The reason that we went with that instead of Pfizer comes in much larger dosage quantities, and it requires refrigeration temperatures that we're simply not capable of. In fact, very, very few people are capable of it. So we were notified on Sunday that we would be receiving the Mederna vaccination on Monday. Monday afternoon, we did receive the vaccination. We received 600 doses, and the standing orders came on Tuesday afternoon, which allowed our nurses to go ahead and start inoculations after that. On Wednesday, the team that needs to be here to put together the shots, the team doing the paperwork as well as the nurses, we inoculated 10 people yesterday to make sure also that they would be safe in doing the inoculations, but also to make sure that they didn't suffer any side effects and would end up becoming ill and not be able to perform the inoculations when they start. We only have so many nurses, and we simply cannot afford to lose any of them.
We received our standing orders for Dr. Lundquist so that we would be able to move forward with the process. Very important to make sure that we fill out all the paperwork necessary and track all of the vaccines that are administered.
After the nurses have been inoculated and the appropriate staff for paperwork, the next series of folks to be inoculated will be our tribal elders. And our tribal elders, folks at the Tribal Center, are working on that right now. Crowell and Donna Saigo are calling elders right now, and we're starting with the most aged and the folks with PreExisting Conditions, and we're going to get them inoculated first on Monday. There's an awful lot of work that has been gone on behind the scenes over an extended period of time to bring us to this point. The getting the shot is kind of the very, very last part of the climb of the mountain, and it's the easy part to see, but there's just a tremendous amount of work and effort that has to go on before, and has gone on, to get us to this point.
Just because we receive a vaccine does not mean that we are completely 100% safe. We still have to be mindful and follow all of the health and safety protocol that we have been using these past several months. So that means that you still need to wear your masks, you still need to maintain your physical distance, and stay within your family group, your small family groups. It's so important. Wash your hands, do all the things that we've been doing to protect one another. The other thing that is super important is to make sure that you show up for your second vaccination dose. This first vaccine will get us through, and then we have a waiting period. You will be called back for another appointment to get your second dose, to build up that immunity, which is super important.
Barbara's got her team already set for it to be warm. Yeah. It's better than outside.
But you won't get rained on.
You won't get rained on. You'll stay dry.
And we got open air.
No, it's